Hello?
Hello.
Hi, how are you?
Hi, we made it happen. How are you?
All right, thank you very much.
All right. How is it going? Happy
Also,
Friday.
happy Friday. That's right. I have my
Is
days.
that a beard I'm seeing?
Yeah, a little bit.
Ah, different look for the quarantine.
It's the COVID look, I guess you could
The,
say.
the healthy COVID look, though.
Yeah.
But you guys are still open, right? Limited hours, but still open?
Limited hours, 2 days of the week that we're open right now. Uh,
Okay. What 2 days are you open? I'm curious because I'm 2 days also.
Tuesdays and Saturdays.
Okay, Tuesday and Friday. I don't know what it is about Tuesday. People still want to make sure they're getting treatment. So,
Yeah, well, I think that Tuesdays are good because it's in the week.
hmm.
Days are too close to the weekend. Although now with COVID being here, I think everyone's days are all mixed in together, and no one really
It's so true.
you don't know which day is what.
Yeah, exactly. I have a couple questions from people who weren't able to join that we'll kind of like launch into. But if you guys have questions as we go along, feel free to mention them in the chat. But Dr. Nazarian, do you want to do just a little intro as to who you are and what your practice does? And I can do the same since we're engaging with each other's following right now.
No problem. I'm a chiropractor. I've been a chiropractor for 25 years. I am one of the providers at IHS Medical Group. We're an integrated practice. Our integrated model is a medical office where we combine holistic and medical care together. So there are many things that we do. We do rehab for spine, for extraspinal joints as well. We do a lot of posture work, but we also, and then we do rehab with patients with disc issues, spinal, neck, loss of curvature, things of that nature. But also, we, on the medical side, our providers also do things relating to regenerative medicine. Um, uh, we do excuse me, we do vitamin injections, which is a very big deal now with the immune system being a concern.
Mhm.
Um, we do some cosmetic work as well, utilizing regenerative medicine. Um, oh, and functional medicine, which is one of my passions. So we
Something we
we
have in common.
yes, so we do a lot of different things to help as many patients in many ways as possible. And so in our office, we have multiple providers for each patient. Potentially, that's what's available to them. So
That's awesome. And people need that, I think, now more than ever. There's this desire to, of course, stay home, follow the stay-at-home order, be careful. But I think it's wonderful to see so many medical practices that are still able to provide patient care. I know you and I were talking about how we've kind of made adjustments in the practice um, in order to accommodate all of that. I'm a licensed acupuncturist. I also practice functional medicine. I serve more as a facilitator. So right now it's just me as the provider in my practice, but most of my patients have an entire care team working with, different practitioners of different specializations to really create this, heavy integrative model, which I really think is the, medicine of the future. Patients need more than one person to address all their needs. But, we need more than ERs open right now. So it's really wonderful to see that patients still have options to stay healthy, um, to go see someone and to have medical providers who have the wherewithal that, okay, well, we need to adjust to the current situation. We were talking about how much cleaning gets done. I already changed the sheets. I already practice clean needle technique, all of these different procedures. I always say like, well, I was washing my hands before it was trending. Um, but now we were talking about how we're doing that in front of patients more. We're communicating that to patients more, even though it was something we were always doing on the back end. It's become really important that patients know, it's still safe to come here. And we're doing everything we can on our end, and making sure we're up to date on all of the current information so we can still keep patients safe and they don't let their health fall by the wayside at this time.
That's true. I mean, in our office, we're constantly mindful of being clean in the office, disinfecting the rooms, the front desk. We have an ozonator in the office to keep the air fresh. Have oxygen in the office to reduce the chances of germs in the air. We have masks on. So it's really important for patients to know that the offices are safe, at least the offices that are open. I can speak for and yours, I guess. But it's also important for them to know that we're open and we're here for them, so that they're not feeling with that. Okay, I have to stay home and I'm gonna have to write it out, and hopefully I'm not gonna get this. It shouldn't be like that. It should be where you follow the stay-at-home order, but you also do everything you can to strengthen your immune system, to strengthen your nervous system and body, so that overall your body's strong enough to fight off anything it comes across. So that's our mindset in our office. That's the mindset I feel that people should have. I've said it in the past before that wellness is a verb. It's not a state of being. It's actually something you have to achieve on a daily basis. So whether we're in this COVID thing or whether it's just normal average day, you have to achieve wellness. You have to do wellness. And
That was my favorite quote of yours from the podcast. So for those of you who don't know, I had Dr. Nazarian on my podcast. It's available in the link on my profile. Be Well with Dr. Nell is available on Spotify, Apple Podcasts. But the first episode that we put out, because it was so a great way to kick off all of these talks about integrative medicine, was the podcast with Dr. Nazarian. And that was the headliner quote that we have for the title of the podcast, about wellness being a verb. It's something that needs to be practiced. It's something that's incorporated in your day-to-day life. You don't get to just check a box and say, all right, I've reached wellness now. It's something that changes based on the situation and your life and what's going on. But it's important to mention, you had said, not just keeping your immune system healthy, but keeping the nervous system healthy. And I had a question from a friend of mine who wasn't going to be able to make this talk and wanted to ask, with offices being open, are all of your procedures still happening? I feel like I'm letting all of the little things that I was focused on my health fall by the wayside and only have been hearing about immune health. So I'm very passionate about this. I think we should both take this question. Like you said about the nervous system, your whole body supports your immune system. An immune system that's functioning poorly is just a symptom of something going on underneath. So you can throw, all the echinacea at it you want. But if your body is still having other health issues, you're functioning in this suboptimal state, and you're not going to have a healthy immune system. So even though that seems to be all that everyone's talking about, and it's certainly important to support that with all of these different therapies, you don't want to let your chronic pain become more of a debilitating issue at this time. That's going to put more stress on your system, and that's going to make your immune system function poorly. So that's how I feel about that. Anything you want to add to that question about, is everything still happening? Can I still address my, other health issues at this time beyond the immune system?
absolutely. I can add a lot to that, but I'll try to keep it short. Well, for one, yes, it's crucial that you take care of every aspect of your health now more than ever. It can't be where you focus only on immune system, because the nervous system of the body, the physiology is based on the function of the nervous system. The nervous system controls everything, including your immunity. So it's more important than ever to either whether it's acupuncture, whether it's chiropractic, whether it's functional medicine, whether it's provided from a medical provider, to maintain the health of the nervous system so your body is strong so that it can withstand being exposed to any virus, whether it's COVID or whether it's the flu, influenza. It should not matter. If you have a strong immune system, you can be in an elevator with a bunch of people who are coughing and sneezing, and you're not going to get anything that they have because you have a strong immunity. So currently in our office, yes, everything is available for our patients. We want to make sure that people don't get sick. In fact, in our office, we are giving free B12 injections to anyone who wants it, whether it's our patients or it's someone off the street. It doesn't matter. We're here to help people. But
That's amazing.
so it really, it's something where you want to be cognizant of your overall health. Everything from eating well to sleeping well, having good things up in here. Health is it's like a triangle. It's got the emotional, the chemical, and the structural aspects to it, and you have to address all three and be mindful of everything. So it can't be just, oh, I'm going to have to take vitamin C. There's a lot more than just that. So I'm in agreement with you on that one. I think that you do have to encompass everything in the overall picture rather than just one thing.
Yeah. And it's a very, you know, appropriate time to address health issues and that we have the time to do that. I've certainly filled my time, but there's still, I'm not going to events. I'm not going to networking things. I'm not like going to the theater. I'm not doing a lot of the things that were taking up time. So even though I'm still treating, I'm still writing, I'm still teaching, everybody still has a little more time at this point. The schedule has shifted. So to be able to build in some really healthy and mindful techniques to your day to day, like creating a wind down technique in the evening, so that you can help improve your sleep. There's so many opportunities that we can implement right now because we do have such control over our environment. It's not like it was where it's like, no, we're out all night, we're doing all these things. So, I don't have time and my, schedule's off. Well, you can make your schedule a little different at this point. You can take inventory of what was working and what wasn't, and figure out, okay, how do we better our health? But I think it's important to not get this linear focus on, oh, the only thing I'm going to focus on is my immune system, because your whole body needs support right now. Are you seeing any trends that are different in your practice now than maybe a month or two ago? Was there, a huge rush-in of immune support people or chronic pain, or has it been pretty consistent with how you were treating beforehand?
I think that the good thing is that people are following the stay-at-home order, so a lot of people are staying home. Those people who are in need of care, they're coming in. I would have to say that it's proportional to what we saw in the past, where it's musculoskeletal, and there's some medical as well. There are people who are coming in for injections for vitamin injections. Uh, we have been very adamant about patients taking high levels of vitamin D and vitamin A. Uh, I'll go into that if you like later. But
I'd like to, because it often gets overlooked. It becomes all about vitamin C, and that's not the only uh, important vitamin for your immune system.
Going back to what you mentioned about helping sleep, one thing I could advise patients is that one of the best things you can do to sleep better at night is at bedtime you do stretching. If you stretch at night, at bedtime, just before you turn the lights off, just sit on the floor and stretch for like 5, 6 minutes. Stretch multiple muscles in the lower extremities, in your hamstrings, your quads, your glutes, your hip flexors. You can stretch your chest with the doorway, and then go to bed. You'll sleep better because of the increase of blood circulation you create, the more oxygen that reaches your cells and your brain. It calms your body, and you sleep more soundly, and you'll wake up in the morning with less overall stiffness if you had any. So that's one quick tip I could give you.
I like that because we were going to make sure to incorporate some tips at the end of this. So I like that. I think that should be incorporated with a wind down routine, something that you're telling your body, like shut all screens off more than a half hour before bed, no phones, no computer, no TV. And then, yeah, you can be brushing your teeth. You can do your stretching. If you want to read, you can read, but it's just a signal to tell your body, hey, it's time to go to bed. What's the deal with stretching before bed? Is it a circulation thing? Is it just, again, a signal for the body to relax? Why do you think it's so beneficial for sleep?
It increases blood circulation. It does help with flexibility, of course. However, the net effect is the increase in blood circulation, and that means more oxygen reaching every cell, tissue, and organ of the body. And the more oxygen reaching the brain, the easier it is for it to calm down. The rest of the body can relax much better when there's increased oxygen and circulation through your body. And incidentally, I could also say that, the most amount of strokes that people get statistically occur in the wee hours of the morning, between that 5 a.m. period of time. That's the time where most strokes occur. Well, when you stretch at night, you increase blood circulation, which means more oxygen everywhere, but also to the brain. So it can actually reduce your chances of having a stroke at night if you have increased oxygen. I'm not saying that you won't get it, but it reduces the risk when you have more oxygen reaching the brain. So stretching is the number one way you can get that done at home alone, and you don't need help.
And what I love about stretching is it's very different stretching in the evening versus working out in the evening. When you work out hard, you're going to spike your cortisol. You're going to, put this intentional, but still a physiological stress on the body. Not that there aren't people who can't work out successfully in the evening, if that's, when you got to get in, I understand. But there is something that goes along with that workout process that does put your body into that sympathetic state. It's not always conducive for sleep for people. And so with stretching, you still get the benefit of increasing the circulation without turning on the body's alarm system that, oh, it's time to be alert. So I think that's amazing. And it makes sense with the reducing the risk of stroke as well when you look at the figures. But I love it as part of that wind down routine. Nourish your body with the blood. So
I absolutely want to do that, especially nowadays that everyone is at home. We're all at home. We're not doing much and not moving around, and everyone's just sitting and watching, whether it's TV or the computer or etc. And so what happens is that there's less movement. Less movement means less circulation of blood, less oxygen. And so everyone gets lethargic and everyone gets tired more. And so once they get out of the day and they go and do a walk or something, they get tired quicker than they used to, mainly because they're getting used to being sedentary. So it is very important to be stretching throughout the day, all day, so that you have circulation. But stretching at night is a very key thing to do. It helps many things. So I always advise to do that.
moving during the day, good for brain power too. For all of us who are sitting at home on our computers trying to focus, your brain is not going to work optimally if you don't have blood flowing through it and getting oxygen to your brain. So movement is incredible medicine. I want to go back to supplementation because I want to give people just like a couple takeaways from this. So I think stretching and doing what your body naturally wants to do, movement, is key. But what about some favorite vitamins or supplementation at this time or in general for people's health? You and I both work very customized to the individual. So everyone who's watching, do not take this as like, our general protocol, but we want to give you all some information that you can look into.
Yeah. Well, with vitamin D and vitamin A, I think that right now with the climate that we're in with COVID, these are the two two nutrients that everyone should be taking. It doesn't matter male, female, it doesn't matter age, it doesn't matter for anything. Uh, uh, the reference ranges for vitamin D changed back in 2011. Now the reference range is between 30 and 100 nanograms per nanoliter. So between 30 and 100 is a very wide range. If you have a blood test and they say, oh, it's normal, but if you look at the number and if you're at 38, well, that's normal, but it's very low. And studies show that people who are 20 or below have an increased chance of developing cancer, death from pneumonia, or getting the flu. So it has a big job in making sure that the immune system works well. It's an immune modulator. And so it makes sure that your immune system works properly and on time and you have quick immune response so that if you come in contact with something, your body can work very quickly in nipping it in the bud. Also, if you have a virus, if you come in contact with a virus, your immune system will produce immune cells to take care of a virus, not immune cells to deal with the bacterial infection. That's improper response from an immune system. We don't want that. And so vitamin D helps with that. There are many other reasons to take D, but for now, for what we're going through right now, you want to take vitamin D. The amount, because of what's happening, what I've been recommending is 5,000 international units of vitamin D daily for people under 60. Under 60, you would take 5,000 units a day, and then you would take 25,000 international units of vitamin A. You do need to take A with D because A helps you absorb D. There are many times patients will take D and we take blood tests and they're not going up. And I say, are you taking A? And they say, no. You got to take the vitamin A with it. Once they start taking the A, the numbers go up. So you do want to take 5,000 international units of vitamin D, 25,000 international units of vitamin A daily. For people who are 60 and above, it's 10,000 international units of D and 50,000 of vitamin A. This is a general number. It's not a specific thing that we're prescribing for any one person. It is a general amount you should take to help boost the immune system. A and D, when taken together, is like a turbo boost to immunity. And so this would be a good start to take. I've always been telling patients to take vitamin D. Before the COVID pandemic, I based it on skin color. It's the most accurate way to do it because the darker the skin, the more pigment you have. This pigment blocks the UVA rays that your body utilizes to make vitamin D. But at this point, we all need it so much that you can toss the skin color usage and just take 5,000 if you're under 60, 10,000 over 60. Once this pandemic passes, then you can slowly ease down, and then you could go to basing it on the color of the skin. So people with fair skin, so the people who actually go in the walk across the street and turn red from the sun, those people would take 2,000 units. People with light olive, 3,000, dark olive, 4,000, and black skin, 5,000. So that would be once the pandemic is all said and done. But for now, stick with 5 and 10. That's what I would tell.
Thank you so much. That's really helpful. I always get like an incredible energy boost when I take vitamins A and D. And I think what you said, it's important to note like these, like being an immune modulator is very different than just blindly throwing things at the immune system to boost it, which can be challenging for an autoimmune patient whose immune system is confused and doesn't know, what it's looking at. So, immune modulating, balancing the immune system, making it function in an optimal way is really what we want for everyone because everybody's body is different. But optimal functioning will look different for everyone, and that's, the end goal. So, all right, so we have stretching and then vitamin A and D. And I would just throw in with stretching movement. So movement is relative for everyone. We should all be moving in some way, shape, or form. I think the more sitting you're doing, the more you need to be counteracting that with some movement. So we're all a little guilty of sitting too much at this point, being at home. I applaud everyone for listening to Stay at Home Order and staying at home, but you got to get up and move and get the circulation going to your tissues and your brain. Anything
I,
else beyond these?
I always tell patients, movement is your friend. Most of my patients, they hear that so much, it's like a little jingle for them. So, uh, really, movement is so crucial, especially in these days where we're not moving around. So, if it is possible, go out and take a walk. Take a walk in the neighborhood. You don't have to go where there are people congregating. Just go ahead and take an easy walk, going walk. It could be as long as you can take. Go with what your body can handle. Never go past that. But if you can go for a half hour, that's great. Do a half hour. Do it a couple times a day. If you can't go out for a long walk, take 10 minutes. Go 10 minutes, and then a couple hours, go for another 10 minutes. A couple hours after that, go for another 10 minutes. Just make it frequent. We all have more time now. So, and especially for those people who are working from home, you really want movement. So you want to schedule your work day at home the same way you would have it at work. So you take a time off for work, during work for lunch, take a break, go out for a walk, get a bite to eat, do something like that. So movement is very important overall. Um,
It's
another
the time to get in touch with your schedule and figure out what's going to work because this is not something that's going away tomorrow. There are going to be constant adjustments we need to make. And you guys that are watching, if you want additional information, you want something a little more customized, I have put my Instagram handle and Dr. Nazarian's as well. There you'd be able to find both of our practice information going there. I know it can be a little overwhelming at this time when you're like, okay, I get it. I need to move. I need to stay healthy. But, I'm having this weird symptom or, I'm still experiencing pain or stress and I want additional help with that. So we're both here to help you. We both are doctors for a reason. We want to make sure everybody has the support that they need. So please keep that in mind if you don't get, all of your specific questions answered through this chat. So I don't know if there's anything else you want to say about that, Dr. Nazarian.
Other thing I wanted to mention is that I'm sure in your patient base, you'll notice that there are people who probably call you and they'll say, or they'll email you and they'll say, I have X, Y, or Z going on. I don't know what to do. The thing is, everyone should realize that just because the coronavirus came and this concern came, doesn't mean that all the other things that we were dealing with went away. It doesn't mean that if a person had migraines, the migraines went away and now it's not a concern. Or if they had digestive issues, those are gone now. Those things, we're seeing those things. I'm sure you're seeing those things. Those
Mm-hmm.
things, they still exist. It's just that there's so much concern about the coronavirus that everyone forgot about those, or it's not. It's on the back burner.
Right.
Don't let it be on the back burner because that back burner will break down and it's going to burn to the point you can't fix it. And it's going to go back to the uncontrolled way it was. So if I tell patients that if you've seen gains, if you've progressed and things have become better, great. Now work on keeping it that way. Don't just let go of your care. Don't let go of your overall health. And because you've been told that you have to stay home, you can't do anything about it. There are plenty of things to do to help your overall health, and so we're a resource, and so you're a resource, and so between your office and my office, and I'm sure there are other places, many places that people can reach out to and get help, and not just stay home and and figure, well, maybe I got to go to the emergency room because I can't handle this pain any longer. No, you don't have to do that. They need to either contact you or contact me if it's your patient or our patient. So
Yeah. Well, the advisement has been unless you are, in need of hospitalization, they don't want you going anywhere near the hospitals. That's not, a place, like it's not where you should go for overflow for pain or for a digestive problem or even for mild symptoms. A lot of people are dealing with allergies right now. A lot of people are dealing with very uncomfortable health problems. And we still care about those problems. We still want to make sure we're here to help you. Like, please don't think that your other issues that, you're dealing with at this time are invalid because there happens to be a pandemic going on. We absolutely have to adjust, the way life is going right now. And everyone should be cognizant of that. But no one should feel that there's a lack of support or that they have to put any health concern on the back burner, because those will eventually boil over if they're not addressed. So I am happy with wrapping there. I feel like people should be stretching and taking their vitamins A and D and reaching out if they need additional support. I really appreciate you joining this morning chat, Dr. Nazarian. I will save this video on stories, so if you guys caught it right at the end, you'll be able to watch it in its entirety. I think we'll also be recording it to put on YouTube at a later date. So thank you so much for joining. Any last words?
no, I guess I could throw in drink a lot of water.
Yes.
A lot of
Yeah.
water. 80% of your body weight in ounces. That would be ideal.
You said 80%?
80% of your body weight in ounces. So if you weigh 100 pounds, you drink 80 ounces of water a day.
Which, with our, current society, we're still getting dehydrated from air conditioning and all of that. But yeah, so stretching, particularly if you're sitting too much or at night, help increase circulation. We have vitamins A and D. You guys can go back in this video for all of the dosages for different age ranges. And then also drinking 80% of your body weight in ounces of water per day. All right. Feel free to reach out to us if you guys need any additional support. Right, Dr. Nazarian?
Absolutely. I'll put this up on our Instagram, so if patients want to read this, or we'll send it out to them.
Perfect.
All right.
All right. Stay safe and healthy. Hello to the family, and thank you for joining.
So you too. You take care of yourself. Be safe.
All right. You too. Bye.